With any type of cancer, the sooner it is diagnosed, the greater the chances of a positive outcome.
And Dr. Arthy Yoga with the Texas Breast Specialist is joining us now to share the 3 steps to self-exams. Welcome to the show.
Thank you so much for having me.
You know, we believe, of course, knowledge is power. I think we've said it now like 6 times since the show started, and that's really it. I mean, finding something yourself is critical when you notice that your body is changing, your breast has changed.
Absolutely. Women should be doing their breast exam starting at the age of 20, actually, and should be doing it every month.
Every month. Okay, and what exactly are people looking for? Because is it a lump? Is it something that's small and hard? Or could it be both of those things?
So it could be variable. You're looking for any changes to your breasts, basically. Any redness, irritation, a lump, could be a large lump, could be a small lump, any discharge from the nipple, and changes, basically.
Well, walk us through the self-breast exam, because I always think like we start under our armpit, or I guess it doesn't matter where you start, but we also have to include the armpit, right?
Absolutely, yes. There are 3 steps to doing a self-breast exam. The first step is positioning. So you want to either lie down or stand up in front of a mirror. You want to put your arm behind your head like so when you're examining the right side, and you can use your left fingertips to do it. So the second step is the exam. You go around circumferentially, starting from the clavicle up here and the armpit, and go towards the middle with soft pressure, then firm pressure. And the third step is to squeeze the nipple and look for any discharge or any lumps.
Oh, I have never heard that part of the equation. And again, you're just looking for lumps or changes, anything that would seem abnormal.
Exactly. If you're doing a breast exam every month, you're looking for changes in that exam.
And would these lumps, do they tend to hurt, or are they just sort of like lumpy? I heard that they're not supposed to hurt. I don't know.
So most breast cancers don't hurt. But what women feel is breast pain from menstrual changes. A lot of the time you're going to have some tenderness before and during your period. If you have a lot of caffeine, you can have breast pain. So breast pain is very common. Breast cancer is not common as the breast pain, and it's not usually associated with breast cancer.
It's so interesting that caffeine could be a contributor. You recently wrote a paper, Dr. Yoga, about breast cancer in males.
Yes.
So while that's far less common than it is in females, is this something like self-breast exam something that men should be doing as well?
So breast cancer in males is rare. It's less than 1% of males that will have breast cancer. The males that should be more vigilant about doing breast exams are the ones who've been exposed to radiation or to estrogen, or if they have a family history of breast or ovarian cancer in their sisters and their mother and their family, they should be more vigilant about doing self-exams. And if they do see any changes, they should contact their doctor and not, ignore it.
But the technique for the self-breast exam on a man is the same.
Yes, it's exactly the same, because men have some breast tissue. It's just on a smaller level than women.
And lastly, when is the best time for these self-breast exams?
So the best time to do it about 3 to 5 days after your menstrual period, because during and before the period, your breasts tend to be a little bit more sensitive, so it would be difficult to do the exam at that time.
All right, Dr. Yoga, thanks so much. And for more info, we can visit texasoncology.com, right?
Yes, absolutely.
We appreciate it.
Thank you so much.
Great
Thanks
information.
for having me.